Healthcare systems cannot be more different when we compare the United States and the United Kingdom. The United States has the largest private sector system, while the United Kingdom has one of the largest public sector systems. Both systems are highly respected and have world-class health outcomes. But the UK healthcare, otherwise known as the National Health Services (NHS), has way fewer health outcomes variation across its population when compared to the US. If you want to discover the main differences between both systems, make sure that you stick around to the end of this video. Healthcare in the US is almost exclusive by private sector providers. Hospitals are owned by either for-profit or non-profit organizations. Most of the people in the US have access to healthcare through a blend of private health insurance, Medicare, and Medicaid programs. Medicare is a federal program that provides health coverage if you are 65 years or older, no matter what income you have. Medicare also provides coverage for people with disabilities, even if they are under 65 years old. Medicaid, on the other hand, is a state and federal program that provides health coverage if you have a very low income and cannot cover your healthcare costs by yourself. The remaining people who are not covered by private insurance, Medicare, or Medicaid will have to rely on their own financial resources to cover their health and medicine expenses. The United Kingdom healthcare system, otherwise known as the National Health Services (NHS), is an ideal example of socialized medicine and a single-payer healthcare system. This means that healthcare is provided by a single payer, which is the British government, and is funded by taxpayers of the United Kingdom. The appointments and treatments are provided for free to patients, as are most of the prescription drugs. Well, let's re-emphasize that it's paid by taxes, so it's not truly free. But the NHS is not entirely free. There are some services that require patients to pay, such as dental and eye care, but the fees are comparably low to the US fees. The maximum cost of receiving any drug prescribed by the NHS is $12. The United Kingdom does allow employers to offer private health insurance plans to workers. Some of these workers decide to opt out of the NHS and receive their medical treatments privately. It is quite an advantage as private patients choose their specialists, unlike NHS patients. Private patients also avoid waiting lists for non-emergency procedures, while NHS patients tend to wait for weeks or even months. When it comes to accessibility, NHS patients receive their primary care from general practitioners, which are referred to as GPs, who act as gatekeepers for secondary care. When it comes to accessibility based on age, the National Institute for Health and Care Excellence, otherwise known as NICE, consults Citizens Council to help it sort through difficult ethical issues such as prioritization of patients based on age, which is simply not allowed in the UK. Patients of all ages should receive the same degree of access to the healthcare system. Now let's compare the US and UK healthcare system. The United States spends more on healthcare than any other country. When compared to the United Kingdom, the expenditures of the US healthcare system are approximately double the expenditures of healthcare system in the UK. It is worth mentioning that the United Kingdom's NHS services have a low cost when compared to other developed nations, according to the World Health Organization. UK spends around $4,000 per person, while the US spends $10,500 per person. That means that the United Kingdom spends around 9.8% of its GDP on healthcare, while the US spends 16.9%. That's a huge difference. But wait, there is always a trade-off for a low cost. The NHS is known for slow responsiveness time. When compared to the US healthcare system, which ranks as number 1 for responsiveness, according to the World Health Organization. The US healthcare system is responsible for population's wants and needs. The UK healthcare is financially constrained, which will result in wants to be constrained. This is seen in the form of a long waiting list for non-essential medical care, which is required by people in the UK, and obviously this is met by long waiting times. NHS patients wait an average of about 8 weeks for treatments that require admission to a hospital, 4 weeks for outpatient treatments, and 2 weeks for diagnostic tests. When it comes to life expectancy and infant mortality, the UK has a better ranking than the US. UK citizens have a longer life expectancy and lower infant mortality. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births. as opposed to 5.8 in the United States. The UK has a more acute care hospital beds per capita and fewer deaths related to surgical or medical mishaps. So you can clearly see how both healthcare systems are different from each other. They both have pros and cons since they follow completely different philosophies. Tell us what you think about these different healthcare systems in the comments section, and which one do you support? If you like this video, make sure to demolish that like button, subscribe, and hit that bell button so you are notified about our latest uploads.